The following program, Know the Cause, is paid for by Pediatric Incorporated.
You need to know the cause. So experts feel the cause of diverticulitis is a low-fiber diet, so guess where they get the fiber, right? 6 to 11 servings daily of bread or grains. Oh my gosh. They're treating this condition with mycotoxins, fungal poisons, which are antibiotics.
Right.
How many of those cases would get better with, say, Sporanox or diflucan, antifungal drugs, and nystatin, and a phase 1 diet, do you think?
I'd have to say 99%.
Really?
Easily.
Whew. Wow.
Because all the situations that cause yeast overgrowth, that's what's happening day in, day out, moment by moment. That's what's happening.
In the 80s, we had somewhere about 6 to 8 vaccines. They didn't even start before age 2. Now there's at least 36 vaccines in the first 2 years of life, and that doesn't even include the brand new RSV, flu shots in kids 6 months and older.
For the past 45 years, I have dedicated my life and my whole career to finding the root cause of disease. And I now know with certainty that we must play a role in our own health care. I'm a self-care advocate, and you know what? Every time you change your diet for the better, exercise, or swallow a nutritional supplement, so are you. Now welcome to Know the Cause.
Part of what I try and do here on Know the Cause is educate you. You don't have time to do what I do. Sometimes in the evening when I get home from work, I begin looking at research, studying it. Have you ever heard of the antibiotics Macrobid or Bactrim? Sure you have. If you're a woman with urinary tract infections, you've heard of it. But what if you're a pregnant woman with urinary tract infections? This is going to be a little bit lengthy, but I want you really to study this. Look, we all have daughters or daughter-in-laws, and we all have grandchildren. You know, we all have wives and daughters and so forth. And we need to know this, folks. Shh. It's almost like it's not leaking out there, but somebody leaked it, okay? Pregnant women, urinary tract infections, and antibiotics. Here's a headline I read the other night. Pregnant women often prescribed risky antibiotics for urinary tract infections. The two antibiotics are Macrobid and Bactrim. I'm still breathing fast from that opening. Pregnant women aren't sometimes, pregnant women aren't rarely, pregnant women are often prescribed these risky antibiotics. Pregnant women with a diagnosis of a UTI are commonly they're doing this. Prescribed antibiotics that are teratogenic, according to the Center for Disease Control. This came out of a major medical journal. Okay, so you're thinking there, as I was sitting there and reading this, I'm going, you have to be kidding me. I study mycotoxins, fungal poisons. Some are teratogenic. What does that mean, folks? I hope you're sitting down. These are commonly prescribed. Oh, she's got another urinary tract infection. Give her Bactrim. Okay, let's keep going. What does that word mean, teratogenic, right? Some antibiotics are teratogenic, ? Medical definition of teratogenic drugs. A teratogen is an agent that can disturb the development of the embryo or the fetus. What? Teratogens halt the pregnancy or produce congenital malformation like birth defects. What? These aren't rarely, whoops, we made a mistake, I'm sorry. These are given to pregnant women. Folks, I'm not here to shake a finger at the medical community, really. It upsets me, it frustrates me, but I worked in that field for many, many years, so nothing shocks me. I'm here to teach you. If you're pregnant, or your daughter or daughter-in-law is pregnant, your wife, and she gets a urinary tract infection, she is probably going to be handed one of these drugs, okay? Since they don't know, you must. That's my whole purpose for being here. The next slide is, many of the prescriptions were likely written by healthcare providers who are not familiar. Oh, tisk, not familiar with the American College of Obstetricians and Gynecologists recommendations. It is important that healthcare providers of various specialties be aware of these recommendations when prescribing antibiotic treatments for women with antibiotic treatments for UTIs to pregnant women or women who might become pregnant in the near future, says the doctor who wrote this article. You know what she's saying? That's a dance. And the dance was, well, maybe they didn't teach this in medical training, but we're putting women on these things. Guys, know the cause is all about you knowing the cause, because they think they know the cause. Oh, we're going to put all women on Macrobid or Bactrim. That's what you do for urinary tract infections. You mean it can cause a birth defect or spontaneous abortion? Well, we don't mean to do. They're not like that. I'm being facetious, but they've got to be careful. UTI diagnosed if bacteria is in the urine. So this article went on to say when women go for a checkup to the obstetrician, they check their urine. Here we go. UTI is the most common indication for antimicrobial use in hospitals for antibiotics. And a significant portion of this use is inappropriate or unnecessary. Specimen contamination should always be considered, as this is common in female patients. Did you ever question, you know what, we're going to have to put you on an antibiotic, but I'm pregnant? Well, don't worry about it. You have a urinary tract infection. How do you know? Well, your urine came back with bacteria in it. I'm a female. It says a significant portion of females end up with a false positive reaction. Why don't we do this again, Doc? Why don't I come back tomorrow? Instead of you putting me on an antibiotic that might induce spontaneous abortion or a genetic deficiency, a genetic mutation in my child and have some birth defect, why don't we do this again tomorrow? Well, I'm very busy tomorrow. I'm being facetious, but I'm angry. And you should be too. That this kind of thing is going on today in doctors' offices. Should bacteria in the urine always be treated with antibiotics? The doctor, and I underscore this, and you, must weigh the benefits versus the potential harm of any medical treatment, including antibiotics, for pregnant women with a urinary tract infection. As this research noted, sometimes the doctors are unaware that drugs have such devastating side effects or prescribe them to non-pregnant women who later become pregnant. I think the two words at the very end of this little dissertation is what it's all about. Be careful. It is incumbent upon you to be responsible for everything that happens in that doctor's office. Sometimes, folks, they're good people. They're always good people, but sometimes they just don't know.
You know, I don't know about you, but I have so many questions why a child today is receiving, 40, 50, 60 vaccinations by the time they're 18 years old. What about by the time they're 18 months old? How many do they get then? And Dr. Deborah Bain joins us right now. She has written a book that I love, Living Out of the Box, a must read, a night, 2-night read. Really a good book. And it will jam mom and dad and grandma and grandpa's brain with information about what's going on in the field of pediatrics. However, you step over that pediatric line, sometimes when you talk about the immune system, not only of children, but of adults, teach us a little bit about the prompting of the immune system with the multiplicity of vaccinations that we have today.
That's a loaded question.
Yeah, and I know, look, you're open, you vaccinate, you have children, but I'm just wondering, as I saw the number go from, okay, I had a sugar cube with polio vaccine, 100 years ago, then there were 2, then there were 4, then there were 6.
Sure.
What are your thoughts on that?
In the 80s, we had somewhere about 6 to 8 vaccines. They didn't even start before age 2. Now there's at least 36 vaccines in the first 2 years of life, and that doesn't even include the brand new RSV, flu shots in kids 6 months and older. So my whole philosophy in our practice, we're not anti-vax at all. It's too much too soon and the wrong kid is not okay.
You put a graphic together on the immune system that I thought was a home run. Let me share it with people and you go over it with them.
Sure. So kids are just sicker nowadays, and there's so much more C-section birth and antibiotic exposure that 70% of the immune system's in the gut. There's more signals from the brain to the gut than the gut is the gut to the brain than the brain is to the gut. Right. So if we have some unhealthy bacteria, we're not detoxing well. We're not absorbing our nutrients, so that leads to inflammation, potentially developing some food sensitivities or food allergies. My kids with head-to-toe eczema, it's a gut issue. It's too much toxins that are coming in, not enough leaving. My constipated kids, it's all about, you know, that evolution of this immune system in trouble. So, and then you develop these nutrient deficiencies, whether it's vitamins, minerals, amino acids, whatever it looks like. All of those are necessary for phase 1 and phase 2 detox. It's science. So if we don't have what we need to detox, guess what? We can't detox. And then we have this perpetual cycle of being sick.
You know, what these other doctors are telling me is very much aligned with what you say and you talk about in the book, living out of the box. And that is maybe wait. That child's going to be around, what, 90 years? Maybe wait a couple of years before this, in my humble opinion, onslaught of, you know, vaccinations. And it's the ingredients. I used to be worried about thimerosal, like in the flu shot. Gee, isn't that a mercury derivative? But today there are other things in these injections. And I understand, Dr. Bain, these are proprietary formulations. They don't want to write down what's in, you know, that. But let's do it a little slower is my whole approach to this.
Sure, and in my practice, we give people choice.
Yeah.
And that's how it always should be. We should not be coercing or forcing anyone to inject any kind of chemical into their body. You would not have surgery unless you had true informed consent. And the problem is, you're just being told it's time for your 2-month shots, and you're not even being told what they're getting that day.
Yeah, you put together this, I thought was so perfect, because on an earlier show I asked you, and this has been at your symposiums, what's wrong with our kids today? And I love this.
Right, it's definitely a perfect storm. So you're getting too much chemicals coming in, you got a poor diet, you have your genetic predispositions, family history of all sorts of neurological things, you know, dad has ADHD, or, you know, there's an autoimmune condition in the mom, you know, with Hashimoto's or something. All of that epigenetics is really a big contributor to why our kids are not healthy today.
You add on food. We see the same boxes, folks, and we go to the cereal aisle of a store. They look like the same boxes when you and I were kids. A little bit different today. Highly processed foods. Just think about that if you have grandchildren or children. Better yet, pick up a copy. Inexpensive, Living Out of the Box. My guest today, Dr. Deborah Bain, has written a couple of books, just amazing. She got out of hospital pediatrics into a private practice that's out here in Frisco, Texas, called healthyKidsPediatrics.com. and doing a wonderful job. Thank you for being here today, and thank you for this book.
You're welcome. Thank you.
Clarice, millions of American moms and dads have this same question. It could be something relatively simple. How old is her pillow? How old is her mattress? You see, if you drool at night, and I think we all do, if you perspire at night, and I think we all do from time to time, and the next night you hit that blanket, you hit that pillow, you hit that mattress, mold, dust, bacteria is going to come up, and while she's laying there sleeping, she's going to inhale that. So she might be allergic to mold is my first thought. Second, in the old days, when I used to do this 50 years ago, we would scratch or prick people's skin with different antigens, ragweed, pigweed, thistle, sage, you know, all sorts of things. Today, a RAST, radioallergosorbent test, is a simple blood test that a doctor can draw a little tube of her blood, she gets to go home, and they can test it for specific things in her environment. Does she have a cat? Is she in a real dusty or moldy environment? Does she sleep in a basement? You might want to test a lot of molds. So those would be my thoughts on this. First, change out the mattress and the pillow. See if after a couple of nights she isn't sleeping like a baby and doesn't wake up with allergies. Next, talk to a doctor and get a RAST test. You are looking at my new best friend. Christine Salter is, okay, let's go through it. Board certified medical doctor, family practice, chiropractor, naturopathic, osteopathic doctor. You remind me of that airplane movie, Doctor. You've got them all. Welcome and thank you for coming in.
Thank you.
I'll never, you know fungus. I mean, the past several years, you're seeing things in these patients and helping patients you couldn't have previously. I'll never forget a guy named David Weekly, Johns Hopkins dermatologist. He brought me to Dallas, Texas in 1987. One day he emoted, tears in his eyes. After hours, he called me in his office and he said, "What are you doing?" And I thought I was in trouble, you know, there goes my paycheck. And he said, "Doug, that was Sandra on the phone with lymphoma. Her oncologist just said it's significantly improved, and he wanted to know why. All we did is put her on diflucan and nystatin and your diet." And I got it then. I really got it. These doctors, they're not fighting me.
No.
They really are too busy. When you were having to see 6 patients an hour, you're way too busy to hear about diflucan with cancer or heart disease. You're way too busy to counsel a person on a diet.
That's absolutely right.
So how do you run a practice then?
See, you know what happens, drug reps usually come to practices and detail physicians.
Okay.
That's the normal practice. There are journals for us to read, but you know, so many journals, I mean, the information is just changing constantly, very fast. So the drug reps come, you know, they tell you everything that's going on, and you say, great. Now, so if someone came detailing about fungus and nystatin and diflucan and showed the data, the doctors probably would go ahead and prescribe.
Wow.
Do you see?
Shall I take that on? Can you see me knocking on
Knocking
doors?
the doors, you know, you see.
But it's every practice. I mean, it's OBGYN, it's gerontology, it's every practice.
It's every
these
practice.
Fungus.
And so the real key is physicians want to be educated. They want the data. We don't want to just randomly doing things for patients. We like to do things, you know, that's evidence-based.
Yes.
You see, so if there really was a rep who would come and say, you know the cause, there's a phase 1 diet, you know, here's the research that shows that this really helps, doctors would do it. They would do it. They would, you know.
I need all of their help. I need the audience to start making appointments and carrying, you know.
Right, exactly.
How do you find time? Your practice is different.
Yes.
How does a doctor find time to sit with a patient and say, well, nystatin is 1 million units. No, you don't need to take 1 million pills. You take a little powder or a tablet, and you take it with a meal because you might get a little upset. How do you find to go over a phase 1 diet with people?
I have a concierge practice, so I get to spend a nice amount of time with my patients. So I'm able to go through the diet, outline everything, go through what medicines they're going to take, what possible side effects may happen, and you prepare them. Because if you don't prepare them, then something happens, they're like, okay, they'll just stop right in their tracks what they're doing. So I'm able to take that time and educate, and that's part of treatment. It's not just giving the treatment, it's educating them about the treatment and why they need to continue. So you say, you may get some flu-like symptoms, but that's okay. It's gonna pass, keep on going. You see, but the average doctor doesn't have that time. So they'd have to relegate it to a nurse practitioner, someone else in the practice who would then have to educate the patient, but then the doctor's got to be really sold that this is really important. I mean, they have diabetic educators, they've got congestive heart failure educate, so they do all that. So if they really understood the importance of this, they would have a antifungal educator.
Wow. In the minute we have left, I don't know how many patients will see a doctor today. Millions.
Right.
How many of those cases would get better with, say, Sporanox or diflucan, antifungal drugs and nystatin, and a phase 1 diet, do you think?
I'd have to say 99%.
Really?
Easily.
Whew. Wow.
Because all the situations that cause yeast overgrowth, that's what's happening day in, day out, moment by moment. That's what's happening.
Today's physician, folks, sees ringworm or vaginal yeast or jock itch or toenail fungus, and he says, aha, I know a lot about yeast. They really don't, until you consider what Dr. Salter just said, that much of what they're seeing on a daily basis has to do with fungus and the byproduct, the poisonous byproduct that they spew in our bodies. Thank you, Dr. Salter.
Thank you.
Hey folks, I worked with a dermatologist 31 years ago right here in Dallas, relocated my family from LA to Dallas to work with that group. There were 3 of them. what we all learned together was amazing. This was a time in my life when I thought fungus was causing a whole lot of problems. They're a skin clinic, and it wasn't just ringworm, which is it wasn't just seborrheic dermatitis, which is dandruff, right, caused by fungus. Guys wear baseball hats and they get out of the shower and they end up with dandruff. We learned a whole lot. And I'll never forget women with skin conditions. Their skin got so much better on the Kaufman diet and antifungals, many of them, not all of them, many of them. And then they'd report back to one of the doctors that several women had polycystic ovarian syndrome, PCOS, right, where they grow cysts on their ovaries. Folks, I've been banging this drum for, 45 years. Fungi make lumps in your body. Fungi make lumps. I think cancer is sometimes, by the way, it's published, overdiagnosed, that they're suffering from a fungal lump, and the doctors are saying cancer. That's been documented. I think that colon polyps, nasal polyps, I think cysts on the ovary, cysts on the kidney, and in this case, diverticulum. These are sacs that shouldn't be there that grow in the intestine. Okay, let's study those for a minute. Okay, what is diverticulitis? Diverticular are small sacs that develop in the large intestine or the colon. These diverticulitis is a name given when an inflammation sets up in these little sacs that shouldn't be there. Experts believe that since it's age-related, everyone will have it if they live to be 90 years old. Oh, great, there's something to live for. Antibiotics and diet therapies used to treat this condition. That's what they use. Most sufferers are male and most don't notice any symptoms, but the doctor goes in and he notices these sacs, these pouches. What made the sac? I'm so tired of us just treating what popped up in our body 6 to 8 hours at a time and not understanding the cause. You need to know the cause. So experts feel the cause of diverticulitis is a low fiber diet, so guess where they get the fiber? Right? 6 to 11 servings daily of bread or grains. Oh my gosh. They're treating this condition with mycotoxins, fungal poisons, which are antibiotics, penicillin, etc. They're treating it with fungal mycotoxins and food that is impregnated with mycotoxins. Do you think that's going to help a patient with diverticulitis get better, sustain their symptoms, or sustain their disease, or get worse? No wonder we never address the cause of anything. Other recommended dietary measures include, but aren't limited to, whole wheat pasta, be still my heart, baked corn chips, cakes, cookies made with oatmeal, fruit, bean dip, and then this, diverticulitis and fungus. When antibiotics and a high-grain diet are recommended, you gotta think, folks, you gotta think, okay? When bowel disease exists, always think of diet first. You eat grains and sugar. Were you on lots of antibiotics as a child? Could those antibiotics have developed the pouches in the gut? Finally, this. Our food supply is commonly contaminated with toxic fungal byproducts called mycotoxins, and most antibiotics are mycotoxins. I can't believe that's how they treat this disease. Ask your doctor if you can try a safe antifungal approach, like the Kaufman 1 diet and the drug nystatin. No side effects to this drug, but it gobbles up the yeast that may be developing those pouches in the intestine. I hope you learn from this, folks. This isn't saying don't go to a doctor. This is saying, gosh, can you talk to your doctor about maybe this isn't bacterial, maybe it's fungal.
In the 80s, we had somewhere about 6 to 8 vaccines. They didn't even start before age 2. Now there's at least 36 vaccines in the first 2 years of life, and that doesn't even include the brand new RSV, flu shots in kids 6 months and older.
How many of those cases would get better with, say, Sporanox or Diflucan, antifungal drugs and nystatin, and a phase 1 diet, do you think?
I'd have to say 99%.
Really?
Easily.
Whew. Wow.
Because all the situations that cause yeast overgrowth, that's what's happening day in, day out, moment by moment. That's what's happening.
The preceding program, Know the Cause, was paid for by Pediatrician Incorporated.